actually born in Taiwan, came to the US when I was 13. I actually grew up in North Carolina, went to high school in Greensboro, went to undergrad at Duke, went to medical school at UNC Chapel Hill. And then because I wanted to do a residency in internal medicine and pediatrics, I went to actually Indiana University. So I think people used to seeing an internist as a doctor for adults, and obviously pediatrician take care of kids. So I wanted to do both, but I didn't want to do a family medicine residency. The difference is that when you do a family medicine residency, you actually rotate through all those disciplines. So you would do internal medicine, pediatrics, surgery, OBGYN, but I didn't want to do that. I just want to concentrate on internal medicine and pediatrics. But that make me double boarded. And so I can take care of baby all the way to their grandparents. I wanted really to be a pediatrician, but when I did my rotation in medical school, I realized that in internal medicine, there are just so many complex cases that are fascinating. I mean, gets my brain juice going, help me solve, it's like solving puzzle. So I really enjoy that and I didn't want to give that up. So that's why I decided to do both. So I think I want to come away knowing that I am their doctor. So come to me with questions, I am there for them. Well, it depends on if it's their first baby or not. So first-time parents, obviously, lots of questions. Is this normal for my baby? I mean, I think parents just want to know their baby's normal, and some of the things to how much do they eat, how much do they sleep, what are the developmental milestones to look for? I mean, when can I give them a bath? I mean, so many questions, and I'm there to help them do all that. And then obviously, when do they get their vaccines? I think everything is focused on the baby, that the mom and dad don't lose touch of themselves because you get so wrapped up in the baby. And if they have older siblings, to make sure that they also feel part of the family, because sometimes they could act out because obviously baby get all the attention and sometimes they can act out. So just to help prepare them for what to expect, and also to make sure that they take some time out for themselves so they don't get overwhelmed. That's the goal of the first visit. Main thing is make sure they're developmentally on track, that they develop normally, they're gaining weight, they're meeting their milestones. As a pediatrician, I do believe in vaccines. I want to make sure they get those vaccines to prevent all the childhood disease that luckily we don't see anymore as they transition from being younger to more young adults. So there are other things to go into puberty to prepare them for that and tell them what to expect. And then as adolescence comes with its own problems, a lot of times we do like to screen them for drug use and also for depression. I love the outdoors. I love the hike. The mountains here, the Blue Ridge Parkway is beautiful. I love hiking. Obviously lots of water sports because I live at the beach. Paddle boarding to me is very relaxing. Love to travel. Love the food when you go on traveling. There's such delicious food and so many different cultures, so I love to travel.